I'd like to talk back to our very common and important topic as hyperemesis gravidarum. We've already repeatedly covered the treatment and also the diagnosis and also the emphasis on the education and awareness for hyperemesis. There is still very little education and emphasis that is put into hyperemesis, a very rare, however, very threatening pregnancy disorder that is currently not recognized by a lot of medical institutions, doctors, midwives, and for a lot of reasons as well. So there's a lot of misinformation regarding hyperemesis out there. For example, the most common one is that they believe hyperemesis is not life-threatening to the baby or the mother. It is simply a natural part of pregnancy, a natural symptom of pregnancy that eventually will end. So Antai Hospital has already dealt with patients suffering from hyperemesis since 2001 and 2002. Until now, we already have 2 decades of experience in dealing with hyperemesis, and we can confirm with you that it is indeed life-threatening to the mother and also the pregnancy, because it can cause malnutrition and also dehydration and all the other severe symptoms. For example, the constant insomnia, constant salivation, the constant emotional instability, all of this combined with their pre-existing disorders or conditions, it really amplifies the effects of hyperemesis and can get very detrimental, very torturous. We've seen many mothers terminate their pregnancies because of how unbearable it has become. Many mothers contemplating suicide because of how suffering it is, when nobody can understand their condition or even recognize it. And many mothers also brought to the brink of their life because of how detrimental it has become, how much weight they have lost, how much dehydration that they have suffered. It is indeed a very life-threatening condition that we need to bring more awareness for. And here at Antai Hospital, we recognize it and we also offer effective treatment. So the second misinformation is that they believe that it only happens within the first trimester and it will quickly go away after week 12 or week 13. This is also a very common misconception. Hyperemesis gravidarum does not function similarly to the regular or the normal morning sickness that we know of. Morning sickness happens within 95% of pregnant women, and that is considered normal because it doesn't bring any symptom that can harm the mother or even the pregnancy. However, hyperemesis not only lasts throughout the first trimester, it can go on to last the entire pregnancy, with symptoms so severe that it can put the mother's life in danger, the baby's life in danger as well. So it does not last just for 12 weeks. It can go on to week 30, week 40, which is why we see many mothers give up their pregnancy. Can you imagine being under that stress and so much severe symptoms for that long of a period, up to 9 months to 10 months, with no effective management periods or treatments available? It is very difficult for them to survive and also hang on to their dear life. Third common misconception about hyperemesis is that it is purely psychological or it is completely made up in their mind. So some doctors and nurses, when they receive patients who believe they have hyperemesis, these doctors do not take them too seriously because they believe hyperemesis is fully psychological and it is simply a figment of their imagination, and all of these symptoms that they are expressing is simply something that is happening in their head. So they believe it is a mental condition, neurological condition, psychological condition. They don't really give you treatment, they don't take you seriously, and then they also send you home. These women end up losing their pregnancy, sometimes their life as well, because doctors do not put emphasis or recognize hyperemesis as a serious disorder that affects pregnant women. Lastly is that the current management for hyperemesis, for those who do recognize hyperemesis, they do not offer effective or clear treatment protocol or management. Many of these treatments include medications such as promethazine or densitron, which is the most commonly recommended medication for hyperemesis, and also IV fluids. These are only just managing the symptoms. For example, they are severely malnourished, and the dehydration IV can solve that. However, the symptoms are still persisting. For example, the severe vomiting, the severe headache, it is still ongoing. Ondansetron, however, does deal with the nausea, but it does not deal with the central sensitization that they are dealing with. For example, the insomnia, the salivation, all that is still going on, and it persists throughout the pregnancy. All these medications that they are currently offering only deals with subsiding the symptoms. However, the root cause is still not being dealt with, which is what makes it last throughout the entire pregnancy. So for these types of management, patients need to be hospitalized for up to 6 months, 8 months, even the entire pregnancy period. So here at Antai Hospital, with over 2 decades of research and treatment of hyperemesis, our treatment does not need you to be hospitalized for that long. At most, we require you to be hospitalized for 2 weeks for monitoring. Our treatment is simply an intravenous injection of our proprietary treatment known as HCG desensitizer. It deals with the root cause. You will not need ondansetron or IV or promethazine. All you need is just 1 to 2 courses of treatment, just a few injections within a period of 1 week, and you will see that your symptoms subside to the point that they disappear. You will be able to sleep, be able to regain your appetite, and also ability to control your salivation, no longer have any other symptoms of hyperemesis because the root cause is being dealt. These are abnormal HCG receptors being blocked. So this treatment is so effective that we offer our patients a full refund guarantee. If you still do not recover within a period of 4 weeks or within a month after receiving our treatment, then we offer you a full refund guarantee. Our hyperemesis treatment is known as HCG desensitizer, and it can definitely help you overcome your hyperemesis and secure you a smooth full-term pregnancy. Get in touch with us today via the website, and also leave me a comment down below.